Neurologist warns, millions of people do this every night without realizing it increases their stroke risk. Welcome to Health Revival, the channel where we share important health knowledge to help you stay healthy, sharp, and independent as you get older. Today, we're going to talk about something very concerning that most people rarely think about. The risk of stroke is actually highest between midnight and 6 a.m., when you are asleep and completely unaware of what is happening inside your body. Many people believe stroke is caused only by aging, genetics, or general health decline over time. But neurologists say there is another very common cause: nighttime habits that many people repeat every day without realizing they are slowly damaging their blood vessels and brain. While you sleep, your body is still working, your heart is still pumping blood, and your brain still needs oxygen. If blood circulation is affected, blood pressure fluctuates, or your blood becomes thicker, the risk of blood clots and stroke can increase significantly. The good news is that about 80% of strokes are preventable if we change our lifestyle habits, especially our evening and bedtime habits. Sometimes, just a small change in your nighttime routine can make a very big difference for your heart, brain, and long-term health. In this video, Health Revival will share some dangerous nighttime habits that you should stop as soon as possible. 7 nighttime habits that increase stroke risk. 7. Sleeping completely flat. Many people believe that sleeping completely flat on a firm mattress is the best sleeping position for health, especially for the spine. This may be true for some back issues, but for the cardiovascular system and the brain, especially in older adults, sleeping flat all night can cause a problem that very few people are aware of: reduced blood flow to the brain during sleep. When you lie completely flat, your blood pressure naturally drops during deep sleep. This is a normal mechanism that allows the heart to rest. However, in older adults, blood vessels are often less flexible, blood may be thicker, and circulation may be slower. When blood pressure drops and the body is completely flat, blood may not flow to the brain as effectively as when your head is slightly elevated. This can cause the brain to receive less oxygen and fewer nutrients throughout the night. This condition may not cause obvious symptoms immediately, but over time, reduced blood flow to the brain during sleep may increase the risk of morning dizziness, headaches upon waking, feeling tired even after enough sleep, and in more serious cases, it may contribute to a higher risk of stroke during the night or early morning. Many older adults say they often feel slightly dizzy when sitting up or standing in the morning. One possible reason is unstable blood circulation to the brain at night, due to sleeping completely flat for many hours. The solution to this problem is actually very simple, but very effective. Instead of sleeping completely flat, you should elevate your head and upper body about 10 to 15 centimeters. Slightly elevating the upper body allows gravity to help maintain more stable blood flow to the brain, reduces the workload on the heart, and helps keep blood pressure more stable throughout the night. However, one common mistake is stacking too many pillows under the head. This can bend the neck, cause neck pain, shoulder numbness, and may even restrict blood flow through the neck. A better solution is to use a wedge pillow, or raise the head of the bed slightly by placing blocks under the legs at the head of the bed, so the entire upper body is elevated gradually, instead of just the head. Many people who change their sleeping position by slightly elevating the head of the bed notice they slept deeper, had fewer morning headaches, experienced less dizziness when waking up, and felt more alert during the day. Sometimes, very small changes in sleeping position can make a very big difference in blood circulation, brain health, and cardiovascular health over time. So if you or someone in your family has been sleeping completely flat for many years, consider trying to sleep with your head slightly elevated. It is a small and simple change, but it may help protect the brain and reduce stroke risk over time. 6. Dehydration before bed. Many people pay close attention to what foods are good for the heart, take their medication on time, and walk every day. But they overlook one very important thing: drinking enough water, especially in the evening before going to bed. It sounds simple, but dehydration at night is one of the silent factors that may increase stroke risk, and very few people realize it. Imagine that the blood in your body is like a river. When there is enough water, the river flows smoothly and everything moves easily. But when there is less water, the river becomes shallow, thicker, and flows more slowly. Blood in the body works in a similar way. When the body is dehydrated, blood becomes thicker, circulation slows down, and the risk of blood clot formation increases. Blood clots are one of the leading causes of stroke. Nighttime is a long period when the body does not receive water, usually for 6 to 8 hours. During this time, the body still loses water through breathing, skin, and metabolism. Another important point is that as people age, the sense of thirst decreases, so many people may be dehydrated without even feeling thirsty. This makes thick blood at night more common in older adults. This is also why many people wake up with mild headaches, dizziness, dry mouth, or fatigue in the morning. Not necessarily because they didn't sleep enough, but because the brain may not have received stable blood flow and oxygen throughout the night due to thicker blood. However, drinking water before bed should be done correctly. If you drink too much water right before bed, you may wake up multiple times to use the bathroom, which interrupts sleep and can negatively affect heart and brain health. So the key is not to drink a lot of water right before bed, but to drink water at the right time. The best approach is to drink a glass of water about 2 to 3 hours before bedtime, and drink it slowly, not all at once. Then, about 1 hour before bed, you can drink a small amount of water, just a few sips or half a glass. This helps keep the body hydrated throughout the night without causing frequent bathroom trips. A small tip that many people don't know is that you can add a tiny pinch of natural salt to the water, so small that you can barely taste it. Natural salt contains electrolytes that help the body retain water better and improve absorption instead of quickly flushing the water out. This helps maintain hydration levels throughout the night. A very small change like drinking water properly before bed can help blood circulation, reduce the workload on the heart, improve oxygen supply to the brain, and reduce the risk of blood clots during sleep. Sometimes, the simplest habits have the biggest impact on heart and brain health without us even realizing it. 5. Taking blood pressure medication right before bed. Many people with high blood pressure have the habit of taking their medication in the evening or right before going to bed because they believe taking it at night will keep their blood pressure stable throughout the night. This is not completely wrong, but in many cases, especially in older adults, taking blood pressure medication too close to bedtime may create a problem that is rarely explained clearly. You need to understand that blood pressure does not stay the same all day. At night, when we sleep, the body enters a resting state. The heart beats more slowly, blood vessels relax, and blood pressure naturally drops. This is a completely normal biological process. However, if you take blood pressure medication right before bed, the medication starts working at the same time your blood pressure is already naturally dropping, and this can cause your blood pressure to fall too low while you sleep. When blood pressure drops too low, the amount of blood flowing to the brain also decreases. The brain is very sensitive to oxygen and blood flow. If the brain does not receive enough blood for several hours during sleep, you may experience symptoms such as dizziness when waking up, morning fatigue, brief blurry vision, mild headaches after waking, or a feeling of weakness in the morning. Many people think this is just due to aging or poor sleep, but sometimes the real cause is excessively low blood pressure during the night. Some studies have also shown that excessively low nighttime blood pressure may be associated with small, silent strokes that occur during sleep without the person realizing it. These small injuries can accumulate over time and may affect memory, concentration, and long-term brain health. However, it is very important to emphasize that you should never stop your medication or change the time you take it without consulting your doctor. Blood pressure medication must be taken according to medical advice. What you should do is talk to your doctor about the timing of your medication. You can ask whether taking the medication in the morning or afternoon would be more appropriate for your condition. For many people, taking blood pressure medication in the morning helps control blood pressure during the day, when the body is more active and blood pressure tends to be higher, while also avoiding excessively low blood pressure at night. Every person's health condition is different. Different medications work in different ways, and there is no single rule that applies to everyone. But what's important to understand is that the timing of blood pressure medication can be just as important as taking the medication regularly, every day. Sometimes, simply adjusting the timing of your medication may help you sleep better, reduce morning dizziness, and allow the brain to receive more stable blood flow throughout the night. This is a small detail, but it can make a big difference for heart health and stroke risk over time. 4. Sleeping in a room that is too warm. Many people, especially older adults, prefer to sleep in a warm or even hot room because they are afraid of getting cold, catching a cold, or experiencing joint pain. This may sound reasonable, but in reality, a room that is too warm can negatively affect sleep quality, the cardiovascular system, and may even increase stroke risk over time. When we sleep, the body needs to lower its core temperature slightly in order to enter deep sleep. This is a natural biological process that helps the body recover, repair cells, stabilize blood pressure, and allow the brain to rest. However, if the bedroom is too warm, the body has difficulty lowering its temperature, which can lead to restless sleep, shallow sleep, frequent awakenings during the night, and waking up feeling tired even after sleeping for many hours. Poor sleep does not just make you feel tired the next day, it also directly affects heart health. When sleep is shallow, the body does not fully enter the recovery phase. Stress hormones may remain elevated, blood pressure may not drop properly at night, and blood vessels do not relax as they should. Over time, this may increase inflammation in blood vessels, which is an important factor related to blood clot formation and stroke. In addition, sleeping in a room that is too warm can cause the body to lose more water through sweating and breathing. This may make the blood thicker during the night, especially in older adults who are already more prone to dehydration. Thicker blood means the heart has to work harder to pump blood, and the risk of blood clots may increase. Many people do not realize that a warm bedroom may be affecting their health. They only notice that they wake up frequently at night, often have morning headaches, sleep enough hours but still feel tired, or have higher blood pressure in the morning. Sometimes these signs are not caused by a new illness, but simply by an unsuitable sleeping environment. Many experts recommend that the ideal bedroom temperature is around 18 to 20 degrees Celsius. This temperature helps the body fall asleep more easily and maintain deeper, more stable sleep throughout the night. If this temperature feels too cold, you can use a thicker blanket or wear socks instead of increasing the room temperature. Keeping the body warm while the air remains cool is the ideal condition for good sleep. A small change like lowering the bedroom temperature can help you sleep deeper, wake up less during the night, maintain more stable blood pressure, and allow blood vessels to relax better. Many people who lowered their bedroom temperature noticed fewer morning headaches, better sleep, and more energy during the day. Sometimes, to protect your heart and brain, you do not need to make big changes. Simply adjusting your bedroom temperature can give your body a better environment to rest, recover, and reduce the risk of cardiovascular problems, including stroke, over time. 3. Sleep apnea. There is a health problem that happens at night to many people without them even realizing it. It's called sleep apnea. This is one of the factors that can significantly increase the risk of stroke, but unfortunately, most people only discover it after their health has already been affected for many years. Sleep apnea occurs when the airway becomes temporarily blocked during sleep, causing you to stop breathing for a few seconds, sometimes 10 to 20 seconds, or even longer. Then the body suddenly reacts, breathing resumes, and you continue sleeping. This cycle can repeat dozens or even hundreds of times in a single night, without the person being aware of it. Many people think sleep apnea only happens to people who snore loudly, But that is not entirely true. Some people do not snore loudly and still have sleep apnea. That's why you should pay attention to the following signs: snoring during sleep, waking up frequently during the night, morning headaches, daytime sleepiness, difficulty concentrating, constant fatigue even after sleeping enough hours, and especially frequent nighttime urination. Many people think waking up to urinate at night is just due to aging or kidney issues, but sometimes the real cause is sleep apnea. The danger of sleep apnea is not just feeling tired. Every time you stop breathing, the oxygen level in your blood drops, and your brain and heart are briefly deprived of oxygen. Then, when you start breathing again, oxygen levels suddenly rise. This repeated drop and rise in oxygen throughout the night can damage the lining of blood vessels, making them stiffer, more inflamed, and more likely to develop blood clots. Over time, this increases the risk of high blood pressure, heart disease, and especially stroke. In addition, sleep apnea keeps the body in a mild stress state all night long. The heart has to work harder, blood pressure stays higher, and sleep is never truly deep. You may sleep 7 to 8 hours but still feel exhausted, as if you didn't sleep at all. If you or someone in your family has symptoms such as snoring, poor sleep, frequent awakenings, morning headaches, or daytime sleepiness, you should consider getting a sleep evaluation. Today, sleep testing is much easier than before. In many cases, sleep can be monitored at home using small devices, without needing to stay overnight in a hospital. The good news is that sleep apnea can be treated. Many people who receive treatment sleep better, have more stable blood pressure, feel less tired, and reduce their risk of cardiovascular diseases. The most important thing is early detection, because if this condition continues for many years without treatment, the risk of stroke and heart problems increases significantly. So if you think snoring is just normal, you may want to think again. Sometimes, snoring is not just a sound during sleep. It may be a sign that your body is not getting enough oxygen every night. And over time, that can seriously affect your brain and overall health. 2. Stress and overthinking before bed. Many people have a habit that they don't realize is very harmful to their heart and brain, bringing all their worries, thoughts, and stress to bed before sleep. The body may be lying still, the eyes may be closed, but the brain keeps working, thinking about money, children, work, health, and the future. And this affects the body more than you might think. When you are stressed or overthinking, the body releases stress hormones such as cortisol and adrenaline. These hormones are designed to help the body respond to danger, for example, when you need to run, react quickly, or face an emergency situation. But the problem is that the body cannot tell the difference between real danger and worries in your mind. If you lie in bed worrying and thinking, your body still believes you are under stress and starts releasing stress hormones. These hormones make the heart beat faster, increase blood pressure, constrict blood vessels, and make the blood more likely to clot. If this happens during the day, the body can move and release energy. But if this happens at night while you are lying in bed, the body remains in a stress state for many hours. This prevents blood pressure from dropping normally at night. Blood vessels do not relax properly, and the risk of blood clot formation increases over time. Many people lie in bed and start thinking about everything in their lives. Some think about their children, some worry about money, some replay past events, and others worry about their health. They lie there for hours, unable to sleep, or they sleep lightly and wake up often. After many years, this habit not only causes insomnia, but also directly affects heart and brain health. To reduce this problem, there is a very simple but effective method that many experts recommend. About 30 minutes before going to bed, take a notebook and write down everything you were worried about, everything you were thinking about, things you need to do, and problems that are not solved yet. Write everything down on paper instead of keeping it in your mind. When you write things down, The brain feels that these problems have been recorded and does not need to keep thinking about them all night. After writing, close the notebook and leave it somewhere else, not next to your bed. This helps your brain understand that the bed is for sleeping, not for thinking and problem solving. After that, you can do a simple breathing exercise to relax the body. Breathe in slowly through your nose for 4 seconds, hold for 4 seconds, then breathe out slowly through your mouth for 6 seconds. Repeat this for a few minutes. When you breathe slowly and exhale longer than you inhale, the body activates the relaxation system, helping the heart slow down, blood pressure drop, and the body move into a resting state. A good night's sleep starts with a calm mind. If the body is sleeping but the brain is still stressed, that is not true rest. Over time, nighttime stress can silently affect blood pressure, blood vessels, and increase stroke risk without you realizing it. So before you go to sleep, let your body rest and let your mind rest too. 1. Eating late at night or within 3 hours before bed. Among all nighttime habits that affect heart and brain health, eating late at night or eating too close to bedtime may be one of the most dangerous habits. Yet, it is very common. Many people have the habit of having a small snack before bed, drinking milk, eating fruit, cookies, or even having a small meal at 9 or 10 p.m. because they think eating a small amount won't matter. But the body works very differently. When you eat, the body has to begin the digestion process. The stomach, intestines, liver, pancreas, and many other organs must work to process the food. This increases heart rate, sends more blood flow to the digestive system, raises blood sugar levels, and puts the body into an active state instead of a resting state. Meanwhile, nighttime is supposed to be the time when the body rests, recovers, and stabilizes blood pressure. When you eat too close to bedtime, the body has to digest food while you are trying to sleep. This reduces sleep quality, increases the risk of acid reflux, bloating, difficulty falling asleep, or shallow sleep. But the problem is not just about sleep. When blood sugar rises at night, the body releases insulin to lower blood sugar. Then blood sugar may drop again, and the body releases stress hormones to raise it back up. This cycle causes blood pressure fluctuations, makes the heart work harder, and affects blood vessels. In addition, lying down with a full stomach increases the risk of acid reflux. Stomach acid can stimulate the vagus nerve and affect heart rhythm, sometimes causing irregular heartbeats during sleep. Irregular heart rhythms, especially atrial fibrillation, are one of the major factors that increase stroke risk. Many people do not realize that the habit of eating late at night for many years can lead to weight gain, high blood sugar, high blood pressure, and cardiovascular problems. They think they are eating only a little, so it doesn't matter. But the issue is not only how much you eat, but when you eat. A very important rule to protect your heart and brain is to stop eating at least 3 hours before bedtime. This gives your body enough time to digest food before you lie down to sleep. When you go to bed with an almost empty stomach, your body can focus on resting, repairing cells, stabilizing blood pressure, and balancing hormones throughout the night. If you feel hungry at night, instead of eating, you can drink warm water, herbal tea, or simply go to bed a little earlier. After a few days, your body will adjust to the new eating schedule, and nighttime hunger will gradually decrease. Many people who stopped eating late at night noticed that they slept better, had less acid reflux, felt lighter in the morning, had more stable blood sugar, and improved blood pressure over time. Sometimes, simply changing your dinner timing can reduce a lot of stress on the body during the night and lower the risk of cardiovascular problems, including stroke. Before we end today's video, Health Revival wants you to remember this. Stroke does not always happen suddenly. In many cases, it is the result of small habits repeated every day, especially nighttime habits. Habits like eating late, dehydration, stress before sleep, poor sleeping position, or a bedroom that is too warm can slowly affect your blood vessels and brain over time. The good news is that you don't have to change everything at once. Just start with a few small habits like not eating late, drinking enough water, relaxing before bed, and keeping your bedroom cool. Small changes done consistently over time can make a very big difference for your heart and brain health. Health Revival would also like to note that this video is for educational and informational purposes only, and is not a substitute for professional medical advice, diagnosis, or treatment. If you have medical conditions or are taking medication, please consult your doctor before making changes to your routine or medication schedule. Thank you for watching Health Revival. If you found this video helpful, please share it with your family and friends, and don't forget to subscribe for more health and longevity tips in our upcoming videos.